Hi, beautiful people. I want to talk to you today about something that's really close to my heart, and it's going to tie into this video that I'm making. I lost my brother in 2022 to what some people would say was from cancer, but I know that I lost my brother to a subpar and a neglectful healthcare system. And to go further into that, my brother was 49 years old when he began to start falling at work and having a lot of leg pain. And when he was going to the doctors, these doctors were continually doing x-rays saying that he had bursitis and telling him to rest in bed for the 4 days he was off from work. And then that would give him the energy and the strength to do the 3 night shifts that he would do at work. And I knew that that did not make sense. And so after a bit of time of my brother doing this and seeing that there was no relief, I told him that you need to let them know to do some deeper testing. And ultimately, when they did this testing, when it was demanded that they did it was found that he had stage 4 cancer that had spread to his bones. And this is why he was having such immense pain in his legs. Beyond that, he went into getting his care for cancer treatment, and toward the end of his life, he was having a lot of abdominal pain that we were having him go back and forth to the doctor about. They didn't seem to really take his care and his discomfort seriously. But in the end, the last time that we demanded that he go to the hospital, they found that he had a fever. And if anyone doesn't know, one sign of pain that's not being relieved can be infection. This fever was an indication that he had an infection. Ultimately, he had an infection in his stomach. He was hemorrhaging in his stomach, and it is actually what caused his demise. And one thing that I know about this traumatic experience that my family endured is that my brother got the care he received when he was more informed about his rights and more informed about the whole process and the dynamics behind his care, the reasoning behind anything that was being done for him. That's when he would get better results. That's when he would be more proactive because he had an understanding. And so that is why I'm making this video today. It's in the realm of psychiatry because I work in psychiatry, but I want people to know 5 things to know about your therapist before seeing a therapist, or 5 things to know about therapy before seeing a therapist. So let's get started. So my name is Crystal Turner. I am a psychiatric nurse practitioner who's going holistic because I know to be whole is to be healed. And talking about these 5 things to know when seeing a therapist, I think are really important because, again, to be informed, and when you're informed, you really do have better end results. Your outcomes, and research shows that a person's outcomes are better when they are informed. So let's inform in this video, and I want to try and not ramble. So I'm going to try and get this done in 10 minutes. So let's see if I can do it. The first thing that I want to mention is, and I'll do a video about this that's longer, but there is a difference between your therapist and your psychiatrist. There's a difference, and I want to bring this up because a lot of times when patients come to see me, they think they're coming to me to receive therapy, and I'm not a therapist. So I work in the role of a psychiatrist. I do that through a role of being a psychiatric nurse practitioner. So I am a psychiatric provider, which is different from a therapist. So a therapist usually deals with a person's emotions. They take them through different ways of addressing past issues or thought patterns or emotional dysregulation that a patient could have or a person can have. They really help a person in a lot of aspects from their emotions, if it's dealing with negative thinking, if it's dealing with trauma from the past and these things that are impacting how you're living and the distress and the mental distress that you may be having currently, a therapist usually deals with that specifically, the emotional ways and techniques and approaches to deal with the mind in that way. And a psychiatrist or a psychiatric nurse practitioner, as I am, deals more with diagnosing a person and also providing medications. Sometimes we might do some therapy, but most people who work in the role of psychiatry don't have as much in-depth training in therapy as an actual therapist has. That doesn't mean that I don't do some therapy with a patient specific to their mental health needs. A psychotherapist can go beyond that. And it's usually more in-depth and more intense. Often when you are seeing a psychiatrist or a psychiatric provider, a large portion of your time is spent dealing with the diagnosing and dealing with management of symptoms through medication or things along those lines. The second thing that I would want you to know while we're speaking about medicine, when it comes to therapy, is that therapy can be as effective as an antidepressant when a person is dealing with mild to moderate depression. Therapy can be as effective, is particularly when you've found a therapist that you feel comfortable with and you all are really working through different dynamics that are going on in your life, working through different issues. That type of therapy where you really have a good relationship and you all are really doing the work and you're doing the work can really have as much of an effect as an antidepressant for many people when the issue is dealing with depression. Can also be very effective in managing anxiety. So often when I have patients, I'm a big proponent and advocate for getting therapy and even revisiting the need for medication once a person has really been in therapy and really working through a lot of the issues that may have been bringing a lot of distress in the first place. Number 3, know that there are different types of therapy. There is not just one type of therapy, because a person or you may have to experience a type of therapy that you didn't like and you feel like you don't want to do therapy anymore. But let me encourage you that there are so many different types of therapy and approaches to therapy, and sometimes it's really about finding that right fit. So there are people who do psychodynamic therapy where you as the patient may do most of the talking, and through that you may find a lot of revelation through that and through your therapist kind of guiding you along. And there's cognitive behavioral therapy that's much more structured, that really can deal with negative thought patterns and flipping negative thoughts. And there are therapies that deal with doing homework for people who feel like that's helpful for them. There's EMDR therapy, which is a technique used to deal with trauma. And it's very different from the other types of therapy. So just knowing that there is more than one type of therapy, there are a lot of different types of therapy, and getting an understanding of those types of therapy and what really seems to be more helpful for you could be important for you to know. And it could be important if you're seeing another therapist and you want to inform them about that yourself as well, that they know what has been helpful for you or what you have liked in the past. Number 4, I want you to know that when it comes to anyone in this healthcare system, the healthcare provider is there to serve you. Oftentimes, we sit in these seats with patient and provider relationship, and we sit as if the person who's providing the care is in charge, or they are the hierarchy, or they are the boss. And that's not the fact. The fact is that even myself as a psychiatric provider, the same as a therapist, we are there to serve you. So you are able to ask questions, you are able to delve deeper, you are able to, demand that we give you clarity if you're not receiving it. And when you're doing that, and if you feel like you're not getting that, as a patient who has a therapist, know that you have the right to ask for a different therapist. You have the right to decide that you don't want to see that therapist and you want to change to a different therapist. I just don't want you to believe that because you have this therapist and if it's not working for you, that you are obligated in some way to stick with that particular therapist. It does take having a good connection. That's the most important part of therapy, is being able to have a rapport with the therapist so that you can feel comfortable enough to dive deeper into maybe heavier topics that you don't feel comfortable just saying to anyone, or even being able to trust or feel like you're establishing a relationship where you trust this person who's providing you care. If you don't have those basic parts of the relationship when it comes to being with a therapist, then it's going to be hard to really be able to get into those techniques and those treatments that are going to ultimately help your mental health state. And last but not least, and I'm coming a little closer to say this to you, is that you get to steer the steering wheel when it comes to your care. When it comes to therapy, that is not an exclusion of this. So when it comes to therapy, there are many people who don't do therapy because we think that the only type and way to do therapy is to talk about those very dark portions of your past that you may not be comfortable talking about yet. There can be benefits in moving through the past so that it's not controlling your future and your present. But just know that there are also many other things to address in therapy. And it could be finding coping strategies for anxiety that you might have during the day. It may be helping to deal with how to communicate more effectively with people. It could be helping you to become more bold, if that's the right word, or to be able to deal with conflict better. It could be helping you to deal with like the negative thoughts that you may come up in your mind a lot. It could be these things and many more different issues that you deal with in your therapy sessions. But knowing that you have the steering wheel means that when you're talking with your therapist, you can let your therapist know initially, right now, this is not where I'm comfortable talking about, but these are the things that I do want to work on initially. And you will find possibly that when you work with a therapist who hears you and who honors this and who, helps you to work on things that are concerning to you, that it may make you build more trust to go deeper into other matters that initially you just didn't feel comfortable dealing with them. So let me know in the comments if any of these would cause you to go and seek therapy. Would any of these 5 tips, knowing these things now, which one would motivate you more to do therapy or to seek therapy? Or let me know if any of these have been helpful for you. Let me know in the comments section, and I will see you in our next video. Have a beautiful week. Bye.